Imagine this for a second. The very center of your vision, what you used to read, to see a face you love, it just slowly fades away into a permanent, irreversible blank spot.
And that is the reality for millions of people. It's called geographic atrophy, or GA.
It's the advanced, dry form of age-related macular degeneration, AMD.
Right, and it's the leading cause of irreversible blindness in the world,
Right.
affecting, I think the number's over 5 million people. And the terrifying part for patients has always been that there's no way to get the vision back.
Historically, treatments have only been about slowing things down.
Exactly, just trying to slow the decline. There have been no therapies at all to restore vision once that central part of the retina, that tissue, is gone for good.
And that is precisely why we're doing this deep dive today.
Yeah.
The sources we're looking at, they cover the clinical trial results for a system called PRIMA.
The photovoltaic retina implant microarray.
It's a technology that is fundamentally trying to reverse that loss, to actually give sight back. So our mission today is to cut through all the clinical language and really understand how successful this new approach has been. Okay, let's unpack this.
What's so fascinating here, I think, is that PRIMA isn't just a small step forward. It's a completely different way of thinking. It's a paradigm shift.
How so?
Well, before, all the attempts to treat advanced AMD were biological, drugs, things like that. It's a functional replacement.
Wow.
It's basically an electronic bypass for the damaged part of the retina.
And when you look at the mechanics, it almost sounds like something from science fiction. But the idea behind it is actually really elegant.
It is.
The PRIMA system isn't just one thing. It's two separate components that have to work together perfectly.
That's right. So the first part is the implant itself, the subretinal photovoltaic implant.
Photovoltaic, so like a solar panel.
Exactly. Think of it as a tiny microscopic solar panel that's surgically placed right under the retina in the exact spot where the tissue has died off.
Okay, so if that's the solar panel, it needs a power source. It needs light.
And that's component number 2, a special pair of glasses that the person wears.
And what do they do?
Those glasses project a beam of near-infrared light, which is invisible to the user, directly onto that tiny implant inside the eye.
Ah, I see.
And the real beauty is what happens next. The implant takes that light energy and converts it into a tiny electrical impulse.
And that impulse is what the brain can understand.
It stimulates the healthy nerve cells that are still left in the inner retina. So you're completely bypassing the photoreceptors that GA destroyed and sending a signal straight to the brain.
So you're not getting a perfect natural image back, but you're giving the brain a usable signal, an input where before there was just nothing.
Exactly. A light-based electrical input. And we have to be clear, we're talking about restoring central vision, that high detail vision you need for reading, for faces.
The very thing that GA takes away.
Precisely. The peripheral vision is usually still there, but that central part is gone. PRIMA is designed to step right into that gap.
Okay, so to really appreciate how big a deal the results are, we need to understand how high the researchers set the bar for success. The source describes the study with a lot of clinical jargon.
It does. Things like open-label, multi-center, perspective.
Right. But the part that I think really matters for you listening is single group, baseline controlled.
And that is key. Let's break that down. It means that since there's no other treatment that restores vision, they couldn't compare PRIMA to, say, a placebo.
So there's no control group in the traditional sense.
Right. Each participant was their own control. The researchers compared their vision after getting the implant to their own vision before the implant.
And these patients, they were dealing with really severe vision loss. The criteria to even get into the study were incredibly strict.
Extremely. You had to have confirmed geographic atrophy and, critically, a starting visual acuity of at least 1.2 log-Mayor.
Let's put that number into context. What does 1.2 log-Mayor actually mean for a person?
Well, 0 log-Mayor is what we'd call normal 20/20 vision. A log-Mayor of 1.0 is the legal definition of blindness. So these participants were starting with vision that was even worse than the standard for being legally blind.
So they could maybe see hand motions or the giant E on the eye chart at best.
At best. So that shows you just how big of a challenge this was.
Okay, and this is where it gets really interesting for me. How did they actually define success? They weren't just looking for any tiny improvement.
No, the main goal, the primary endpoint, was what they called a clinically meaningful improvement in visual acuity.
And they put a number on that.
They did. An improvement of 0.2 logMAR or more from their baseline all the way to the 12-month mark.
And that point 2 benchmark is so important, right? Because it means the improvement is actually useful in real life.
It has to be. It's not just something you can measure in a lab. For someone starting at 1.2, a point 2 improvement could be the difference between seeing a blur and maybe recognizing a large object. It can impact your daily life, your autonomy.
And they tracked this over time. They tested everyone with the Prima glasses on and off at 6 months, and then again, the final results at 12 months.
A very rigorous process.
So let's get to the numbers themselves. This is where you can really see the potential. The trial started with 38 people who all received a Prima implant.
Right. And as with any long clinical trial, you have to account for everyone who started. The final assessment at 12 months was done on 32 of those participants.
Which means 6 were missing from that final count.
Yes, and it's important to be transparent about that. Sadly, 3 of the participants passed away during the trial from unrelated causes, 1 person withdrew, and 2 just weren't available for the final test.
And that raises a really important question for the analysis, doesn't it? How do you calculate your success rate? Do you just count the people who finished the race?
It's a crucial point. So the researchers did it in 2 ways. First, they looked only at the 32 people they could assess at the end.
And in that group,
In that group, 26 of them, which is 81%, hit that target. They achieved the clinically meaningful improvement of 0.2 logMAR or more.
81%. I mean, that is just an incredible number. When you remember, these people were starting with basically no hope of recovery.
It's a huge number. And it was statistically very strong. The p-value was less than 0.001.
Which, for anyone listening, means the chance of this result being a random fluke is less than 1 in 1,000.
It's a highly reliable finding. And the confidence interval, the range where they're 95% sure the true result lies, was between 64% and 93%. So still very strong.
But they didn't stop there. They went back and addressed those 6 missing participants.
They did, because just counting the people who finish can sometimes inflate your success rate. So they used a statistical method called multiple imputation.
What does that do?
It basically creates a robust estimate of what the outcomes for the missing people most likely would have been based on all the other data. It gives you a more complete, unbiased picture.
And when they applied that to all 38 original participants?
They estimated that 80% of the entire group would have achieved that clinically meaningful improvement at 12 months.
So 80%. That's the big, powerful number based on everyone who started. It really suggests this technology is, well, it's working.
It's a profound finding. It changes the conversation from just hoping for something to having actual data that shows functional sight can be restored.
Okay, so we've covered how well it works. Let's pivot to safety. You're talking about complex surgery, putting electronics under the retina. That has to come with risks.
It absolutely does.
The source material says there were a total of 26 serious adverse events, or SAEs, that happened in 19 of the participants over that year.
Which, at first glance, sounds like a high number.
It does. So how did the source contextualize that? What's the story behind that number?
The really fascinating part is the timing. When did these events happen? And the data shows that the vast majority of them, 21 out of the 26, so about 81%, happened within the first 2 months right after the surgery.
So there's a cluster of risk right after the procedure itself.
Exactly. It seems tied to the immediate post-op phase, the trauma of the surgery itself, not the device failing later on.
Okay, so if the problems happen right after surgery, what happened to the patients? Were these permanent issues?
And that is the crucial follow-up question. And the answer is no, for the most part. The source says that 95% of those 21 events that happened early on, they resolved within 2 months.
So they were temporary?
Overwhelmingly, yes. So while there is that initial heightened risk, the complications tended to be manageable and didn't have a lasting negative impact, which is a very reassuring metric.
Beyond the surgical risks, I think the biggest fear for anyone with AMD is losing the vision they still have left. They rely so heavily on their peripheral sight.
Absolutely. You don't want to trade one for the other.
So did the procedure damage that existing peripheral vision?
That might be one of the most important safety findings in the whole study. The data confirmed that the average peripheral vision the participants had after the surgery was statistically the same as what they had at the beginning.
So no degradation?
None. The implant and the surgery did not compromise the peripheral vision they still had.
That's a huge win. It means it was a net gain. You're restoring some central function without taking away the peripheral sight they depend on.
Precisely. The safety endpoint was looking at the number and severity of all these events over the full year. And what the data suggests is that for someone facing irreversible central blindness, this risk profile seems, well, it seems tolerable.
So let's pull all these threads together. We have the Prima system, this tiny solar-powered implant.
Right. It replaces the function of those photoreceptors that have been destroyed.
And in a really tough clinical trial, treating patients who are functionally blind, it delivered a clinically meaningful visual improvement to an estimated 80% of them.
And when you connect that to the bigger picture, it just fundamentally shifts the goalpost. For decades, the entire conversation about geographic atrophy has been about how to manage the decline.
Just slowing it down.
This study demonstrated, pretty unequivocally, functional restoration of central vision. It moves us into a whole new world where we can actually talk about reversing the effects of this disease with bioelectronic devices.
So when you think about that 80% success rate and the fact that they retained that all-important peripheral vision, this feels like more than just a win for 38 people. This is going to be enormous for the millions who have no other option.
It could catalyze an entirely new standard of care, yes.
But let's end on a more provocative thought, kind of building on the unique way this thing works. The source states the vision improvement was measured with the Prima glasses on, projecting that light.
Right. The implant needs that external power source.
So the core of this system is a high-efficiency photovoltaic implant, a tiny electronal sensor under the skin, powered and controlled remotely by light. If you think beyond just the eye, what other applications could come from a system like this? A durable, subdermal electronic device that you can power and control from the outside using light. Could this kind of architecture change how we interface electronics with the human sensory system in other parts of the body?
Beyond just the retina.
Beyond the retina. That seems like a really fascinating direction for this kind of technology as it gets more mature.